My name is Dr. Devang Patel. I'm both a general cardiologist and an interventional cardiologist, and I practice predominantly at Methodist Hospital and Northeast Methodist Hospital. Our job is to fix various problems that a patient may have through minimally invasive techniques. The original development of an interventional cardiologist was to do angioplasties and stents. That was the original premise, the profession, when he started about 20 years ago. And now they expanded to fixing blockages in the neck and the legs and the kidneys. And now it's evolved into what we call structural heart disease, which is fixing valvular heart disease and congenital heart disease with really minimally invasive, what we call endovascular techniques, where we just go through the blood vessels and fix those diseases or problems that we face. So Tower first started in around 2002, I believe. It initially started in Europe. Basically, it treats aortic stenosis. Aortic stenosis is narrowing of the main valve through which the heart pumps blood. The only way in the past to fix this issue was to essentially do open heart surgery, stop the heart, cut out the old leaflets and put a new valve in. And often this is a disease of the elderly, so patients were getting into the 80s and 90s. And so this was a new technique of essentially putting a new valve in place, a valve in valve, we would call it. The support staff, both nurses and technicians, comes with years and years of training. A lot of them have decades of training, various of these facilities, and we really rely on their technical skills, their knowledge of inventory, their knowledge of drugs, their ability to interact with patients. Often they'll spend more time with the patients, and we're often busy doing procedures. What we see is the screen, and we're not quite sure what's going on with the patient. The nurses are running around, they look at the patient, they may see them in discomfort, they may see some changes in vital signs, the technician may see some changes in the back, some rhythm changes, and they really do alert us. So we rely on a solid team because we often tell our patients, it's not just us. When we have a patient coming with a heart attack, they're the ones who come in, just like me, in the middle of the night, and we basically come in within 30 minutes, and we often have the vessel open within 60 minutes, and that's the whole team. Sometimes we do things that truly saves their lives. Somebody comes in with a heart attack and we get up in the middle of the night and take care of them and they're instantly better. Sometimes it's a slow process where we adjust the meds up and down until they start feeling better, but eventually our goal is to make them feel better and make them live longer.